guys. Get in here, get in here, get in here. You all are highly welcome. I'm looking two ways because I'm looking at YouTube and Facebook. Listen, guys, I bring you greetings today. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Yes, that's me. You all are highly welcome. Today, we are talking about Birth Asphyxia. Okay, so while we are getting ready, I need you all to share this live so that a lot of people will come in. You know why we need people to come in? It is very important people understand exactly what they are dealing with. All right? For more than some years now, people have been trolling this power couple, Mc Mbakara and the wife, claiming that they used their only daughter for ritual. As a doctor, who has been in Nigerian system, Africa, and understand how very hurtful it is that instead of going to the hospital to seek medical treatment, people will go seeking health care from people that are not doctors, people that are not even related to medical training. You all heard the sudden death of Mohbad last year because a quack nurse was treating him. So today we are trying to look at Birth Asphyxia. We discussed Birth Asphyxia in our last video. So today is like a kind of re-echoing, okay? We are trying to make sure people really understand what Birth Asphyxia is, because even when it happened, I knew that this baby suffered from Birth Asphyxia. But of course, I don't go into talking about people's business until they bring it to the Facebook. That's why they call me your favorite doctor. I look at what is trending and I pick the medical part of it to discuss so that I will throw more light so that people understand. Because let me tell you, if you think it is a joke that people don't understand what these things are, don't ever underrate the power of internet. How somebody used the pain a couple is having towards their little one, a medical mismanagement, that this child is going to be disabled all the days of her life, and this couple is struggling to make sure they do whatever thing that they can do to make this child have the best life she can ever have on the surface of the earth. And unfortunately, the person that was trolling them is somebody Mc Mbakara brought to his house to train. So he came into the house and saw that this girl is always being kept away from what the family is doing. They were not keeping the child away because they don't love the child. They didn't want the stigmatization that people are going to do for this little baby that is still growing. And when immediately they came out, I allowed them to come out because I wanted to talk about it, but I said, no, let the couple talk about it. When they came out, the internet went agog. And everybody was asking, what happened? Okay, so you all are welcome. Please share me out here. Yeah, you all are welcome. I'm seeing you all. Please, in my talk show, I like to discuss. If you want to say something, you can always ask me, send me a request so that I can let you in. But for now, I need us to listen. Part 1 of this Birth Asphyxia series, I defined Birth Asphyxia and told you the things that could cause birth asphyxia. So let's just recap a little bit. Birth asphyxia is when a neonate or a fetus is born and the fetus comes out not breathing, not moving, not having any, skin tone. The skin is blue. There's no activity that you can say, oh, this child is moving, and there won't be any respiration. So what it means is that this child was born because she or he has been having low oxygen, either in utero, that is inside the womb, or during birth. So many things can cause birth asphyxia. If the baby is coming with breech presentation and you deliver this baby and there's cord around the neck, or you have delivered this breech and there's impaction of the head is not able to come out, and the us of the woman is holding this baby. If the people delivering this baby are not trained professionals to do the maneuvers to deliver this baby, the baby is going to be compressed on the neck. So when they give birth to this baby, the baby will have bite. I'm going to use the word. Sometimes I'm going to, make mistake of not using the right word, but what will I do? I don't have any way I'm going to be saying bye. DEATH is DEATH, but because of Facebook issue, I have to be careful. Okay. Now, sometimes a baby can be coming with cephalic presentation. That means coming with the head. Everything is normal during the pregnancy. Everything will be normal. But then, guess what? Something may go wrong. Either the mother is having diabetes or hypertension and oxygen, because remember, while the baby is in the womb, right? The mother is totally the fetus is depending on for food, oxygen, and everything, nutrients of all sorts. Okay, so the mother passes all these things through the umbilical cord, and the baby will receive all that, and that is how the baby will grow, right? Now, if there are some things, I'm just recapping what we said last time. If there are some things like polyhydramnios and maternal hypertension and diabetes and everything that has caused problem with the oxygen that the baby is receiving while in utero, that can make the baby to have problem when the baby is delivered. Now, if the baby has been delivered, right, but along the line there was prolonged labor, either because there was cord compression, like I said. Remember, the cord compression I talked about was a child coming with breech presentation. Here in the US, it's contraindicated to deliver a woman that is having breech. Once you see that a woman is having breech, what do? Straight to cesarean section. But because in Africa, a lot of people are poor, and then there's this stigmatization when a woman gives birth through cesarean section. People will be trolling them and say that they are not true women. Okay, so these are the things that can cause a woman to have a baby. If a doctor have told you that you have cephalopelvic disproportion, right? Why will you then go and try having your baby, and then there's problem? You have prolonged labor or obstructed labor, and this baby is now in fetal distress. There's so many things. Like if you give a woman anesthetic agents, okay, epidural early, and the epidural arrests contraction, the baby is in the womb, there's no more contraction, and CS is not readily available. The possibility that the baby inside is going to now start having what we call bradycardia or tachycardia, depending on what is causing the problem. So when you deliver that baby too, the baby is still going to have a sort of birth asphyxia. So today, our main focus today is, what is this score that healthcare professionals use to check whether a child is having birth asphyxia. So what is that score that health professionals, doctors, midwives use to assess a baby that is born? Every baby that is born, whether you don't have any problem during delivery or not, the people, the team that delivered this baby must use this score to check whether the baby is okay or not. I told you before that it is called APGAR score, right? APGAR, APGAR. So it's a mnemonic, right? A stands for appearance, P stands for pulse, G stands for grimace, A stands for activity, and R stands for respiration. Now, this particular score is from 0 to 10. All right? Score 0 means that the baby is pale when it comes to appearance. Okay, remember I said APGAR score. A is for appearance, P is for pulse, G is for grimace. Okay, A is for activity, and R is for respiration, right? So if you have, listen guys, I'm looking at my Facebook and looking at YouTube, so wherever you are looking, just understand that I can't be focusing in one place. If the score is 0 when it comes to appearance, that means there is no pulse. Pulse is when you put your hand at this wrist to check whether the person is having, is breathing well, right? So if the pulse is 0, you are not feeling any pulse, right? It means you are going to do what? Give the child 0. All right? Or if you look at the baby and the baby is blue, the baby is looking cyanosed, you still give it score 1. In the same appearance, okay, you look at the baby and the baby's extremities, that is the hand and the leg. The body is pink, like normal baby, but the hands and the leg is blue. You give it score 1. But if the whole body of the baby from head to toe is pink, you are going to give it score 2. All right, that is for appearance. Then you give another score for the pulse. So meaning if you check the baby's pulse with your hand, I'm talking about people in Africa. Here, they have machines that is going to be checking the baby. If you watch my introductory video, you will see where I said for every person that is having any problem and is in the NICU, that is any fetus that is having problem and is in the NICU, you are going to see a lot of wires and machines. Some are checking the heart rate, some are checking the color of the baby, some, different machines. Some are giving the baby food. So all these machines are out there. But a lot of delivery centers in Nigeria, we don't have them, except when you go to teaching hospitals or big, high fallopian hospitals, okay? So if this baby that is having this birth asphyxia is having no pulse, okay, that is score 0 again. I hope you're getting it. Now, if this baby is also having is having pulse, you've checked it, the baby is having pulse, but the pulse is less than 100 beats per minute, you give it score 1. But if the pulse is greater than 100 beats per minute, you give that score 2. So we've talked about appearance, we've talked about pulse. The next in the APGAR score is grimace. Everybody will be like, it's a big word, what is a grimace? Now, when you deliver this baby and there's no response to stimulation, in Africa, when you deliver a baby, you just hit the leg, hit the hand. Sometimes you use your hand and hit the hand. You're doing that to make that baby move. So if you do that and the baby is not doing anything, you all are welcome. Share me out, so that everybody will listen to this. You hit the hand of the baby and the baby is not moving the hand, is not moving, okay? That is no response to stimulation. That is score 0. All right? And then you hit the baby and the baby give you a weak cry. The baby is not crying. When you born the baby, remember, the baby is supposed to cry very well, right? If you touch the limbs and the baby is just doing and then stop again, you give that score 1. But when the baby is born, some babies can be born immediately in suction, the baby start crying, right? Good. If that baby starts crying, immediately the baby is born, that means you have seen that there is no problem, right? Especially this baby is crying when you give this stimulation, or you give the stimulation and the baby pulls the leg away, right? Remember, the baby is pink. Now, you just hit the baby's leg and the baby pulls the hand, away. That means that is score 2. Okay, so that is for grimace. Now, for activity, all right? The baby is born and the baby is not having any movement. The baby is limp, okay? No movement at all. That is score 0. Now, please share me out. Are you understanding something? Okay, so let's just finish it. I'm talking about APGAR score now, okay? Now, if this baby, when the baby is born, the arms and legs flexes, flex. You give birth to this baby, the baby is just either in a place where they are suctioning him, the hands flex, not extend, flex. That means you give the baby score 1. But if there's activity, mainly you give back to the baby is moving, wriggling back and forth, that is full activity, okay? The baby is active. That means there's active movement of the baby, you give score 2. Finally, respiration is the R of APGAR, like I told you. So if the baby was born and there's no breathing at all, you give you look at the chest, the baby's chest is not moving up and down, that means the baby is not breathing. You mean that this baby is going to have score 0 for not breathing at all. All right? And then if the breathing is slow, and you look at it, it's irregular. The baby will breathe now and then stop. Breathe and stop. It means that there's something going on. We give it score 1. And finally, if there's very strong cry, the baby is crying, and there is also respiration, the respiration is full, you give it score 2. So now, APGAR, the first one, you give 2, 2, 2, 2, 2. It means that it is 10, isn't it? So 10 is full APGAR score. For the one you're giving 1, 1, 1, that means 1, 2, 3, 4, 5, right? That means the baby is having mild to moderate birth asphyxia. But for this other baby that is having 0, 0, 0, 0, it means this baby is in severe respiratory distress and need urgent attention as much as you can to make sure you give the baby oxygen. First of all, immediately you born the baby is not moving. What you do is you start suctioning. Suction the baby. So if this baby is not breathing, all these things I am telling you, this APGAR score, you are going to check them before 5 minutes. Before 5 minutes, the baby is supposed to cry. The problem happens 5 minutes when a baby is born. 5 minutes. When the baby is born, and in 5 minutes, you have not made the baby to be able to cry or even take oxygen, the brain cells are going to die, are going to die. You say, I told you that I'm going to be forgetting the brain, to say bye. But anyway, I don't think Facebook is going to flag this video. So now, this is what happened from my own perspective as a doctor for Mc Mbakara. This baby was born because there was prolonged labor. Remember, she is a primary gravida, right? Now, what primary gravida means, this is her first baby. So this is the first time she's having a baby. In medicine, we know that having a baby for the first time is going to be delayed, right? If I have had a baby before and I'm having another baby, it is 100% that being that I already have a baby before, I'm going to deliver before the primary gravida. Why? Because the womb had already experienced, give a birth, delivering baby, right? Whereas this other lady that is just a new person, the body, the uterine wall, everything, contractions and everything, progress of labor from seeing lochia, from seeing the red blood, from contraction, from the vagina opening, and everything you can talk about is going to take longer for a primary gravida. So that's what happened to this Mc Mbakara's wife. It took a little while for her to get to that point where she will be fully dilated. So that's why probably the nurses were relaxing, because she's a primary gravida. It has already, because that one is a different story altogether, because there's a way we calculate it to know, for every how many hours, how many dilatation of the cervical os is going to happen. So remember, she said the person that examined her was not a medical personnel, was a cleaner. Mind you, this is a teaching hospital. And in medicine, it is not advisable when you see when a woman is in labor, it is not advisable to do vaginal examination, regularly, because you are going to give the woman some kind of infection. So you check the vaginal dilatation depending on hours. Okay, so this cleaner haven't seen nurses do vaginal examination. She doesn't know the reason why they do vaginal examination or how many hours they do vaginal examination. So you can imagine a cleaner Even if she's wearing glove, come on, definitely she doesn't know that she needs to be sterile even to examine MC Mbakara's wife, right? So MC Mbakara's wife was examined, and unfortunately, the probably the nurses, by the time they realized that she was head on P, head on P means that the baby is coming, the baby's head is just there. So they came, it took a while from their discussion for that baby to be delivered. So either reason, remember the girl was saying that the baby was coming in and going out, coming in, when contraction come, the baby pushes, the uterine wall pushes to get the baby out, then the baby will retract back. That is turtleneck sign. In medicine, that means there's something holding the head of the baby to come out. What are the things that can hold the baby's neck to come out? It could be as a result of cord around the neck. So I am 100% sure that because that baby was coming out and going in, there was cord compression. And by the time the nurses realized that, they tried to remove the cord that was wound around the neck of the baby. And this is another, manipulation that doctors and nurses, especially midwives that are trained, do to help this baby that is being delivered. I mean, the baby came with breech presentation. I remember, and this has made me to remember, there's one time when people were trolling her to get pregnant, she was asking them like, do you people know how my tummy is? My tummy used to be very big. That is polyhydramnios. What is polyhydramnios? That is excess fluid. So when you have excess fluid in the womb, the baby is going to be going around the uterus. So it means that the cord too could wander around the neck of this baby. The baby doesn't know anything. Remember, the only thing that is connecting the baby to the mother is the umbilical cord, right? The umbilical cord, because the womb is very big, it will wander around the baby, and then when the baby is about to be delivered, that cord will hold the neck. So that was what happened to that. I'm not in that place, but I know that is exactly what happened to that baby. So when they did the manipulations, and by the time they delivered MC Mbakara's baby, the baby was definitely going to be score 0. It means that the cord has held the baby's neck for a long time, so there wasn't oxygen right from the time the baby started coming out and going in, coming out and going in. So what it means is that for more than maybe 15 or 10 minutes in the uterus, in the womb, this baby had been struggling with that coming in and coming out. So by the time the nurses and doctors removed the cord around the neck and delivered this baby, the baby was already blue, the baby was not having pulse, the baby was not moving in any way, and the baby is not breathing. That means her APGAR score at birth may have been 0, or probably, let's just take it that the APGAR score is 3. 0 to 3 is severe enough that you must have to do something as fast as you can to make that baby breathe. What are the things you're going to be? You're going to be suctioning the nose, you use the tube and suction the mouth. What are you trying to remove? You're trying to remove the amniotic fluid, because when the baby is born, remember, in the womb, they were not breathing with the nose. So the breathing and everything is just from the amniotic fluid, right? From the cord to the mother. Okay? Both respiration, everything. That's why if you're going to deliver a premature baby, they're going to give you steroid to help the lungs of the baby to breathe when the baby comes. So when they had suctioned and made sure that the airway is patent, the baby did not cry. That's what MC Mbakara's wife said. The baby did not cry. So they started, if you have ever watched any video of delivering of a baby, you will see doctors hitting the baby at the back. So they started hitting the baby so that the baby could cry and all that. Luckily for them, MC Mbakara's wife said the baby started crying. Meanwhile, I remember I said, whatever thing from delivery of the baby to making the baby cry must be within 5 minutes. Okay? And then when the baby cries, And that's what I believe. By the time they now did all that, the baby now had Apgar score of 3 or maybe 4 or 5. Anything, Apgar score, anything 7 and below is a form of birth asphyxia. That's classical in medicine. So by the time the baby was born and they had suctioned and made sure that the baby's airway is patent and all that, the next very important thing you must do, if you don't do that, is then your health, your hospital is supposed to be clamped down. It's supposed to be closed. Is to put oxygen, either by ambu-bagging in Africa. Here, I don't think they have ambu-bag anymore in America here. And anyway, believe you me, a lot of babies will not come in with low Apgar score in America, because if they had realized that something is going on, they will do an emergency CS and save the life of this baby. Okay? So this baby, they started suctioning. The baby started after 5 minutes, or maybe after 10 to 15 minutes. The damage has been done already. But babies have a way of, helping to wake up the neurons and all the problem that had happened during the time the baby was not breathing. But guess what? They said there was no oxygen. That was where I shut down. The only one thing to save Mc Mbakara's child was not in that delivery room. That's so sad, isn't it? And at the end of the day, this baby developed the aftermath of birth asphyxia. Okay? Which is kernicterus and different kinds of things, So that's what happened to this couple. Can you imagine when you now see that you were part of the people that were ridiculing this couple? You're using their pain to troll them. They are already down that a mismanagement was done, and you are trolling them too. Okay? Let's show a little bit of empathy. I think I'm going to stop here because I usually don't take a long time in my video, but at least today I discuss Apgar score. Okay? To recap, Apgar score is a scoring that doctors and nurses use to be able to put a newborn baby, to know whether the baby is having severe birth asphyxia, mild birth asphyxia, moderate birth asphyxia, or the baby is normal. Okay? All right. And I said the Apgar score is taken from 0 to 10. 10 being when the baby have a 10 over 10 Apgar score, it means that the baby is 100% okay. That means if the baby have Apgar score of 8 and 10, the baby is okay. But any Apgar score that is less than 7, it must be that baby have severe birth asphyxia, moderate birth asphyxia, or mild birth asphyxia and moderate birth asphyxia. So I hope I've been able to give you and tell you what this is. So do you have any question for me? If you have any question, type it on the comment section and I will be able to answer your question. Now, one final thing I need to say about this is this. If you're pregnant, if you're in Sudan, you're watching me and you saw this video, you are in Afghanistan, you're in any remote area, please, before you decide to take your body to be a sort of experiment, wherever you decide to have your baby, it's advisable to go to the hospital and have the baby. But in Africa, let us face facts, people are poor, they don't have money, and not really money, because from my practice in Nigeria, I realized that our problem is our cultural belief. A woman they believe in Africa, not Nigeria, Africa, that a woman that did not deliver through the vaginal routes is a problem. You didn't deliver your baby. That's nonsense. When you deliver your baby through CS or vaginal delivery, everything is okay. So depending on how you deliver the baby, you will realize that that baby is still human being. So please, my sincere advice to you is make sure you go 2 weeks, 1 month, or whatever to go around the facility that you're going to have your baby. Find out if they have oxygen. Find out do they even have um, the facilities and equipment that you need to deliver of your baby. Okay, so I'm going to stop here today. Hopefully you have learned something. If you ever throw people when they are down, you really need to stop. We are human beings. Let us show empathy. Okay, my final doctor's orders today is go to the hospital and see a qualified medical doctor that will take care of your medical needs. Don't use yourself as an experiment, because you know why? Life is very, very important, very, very sacred. You did not create any life, so you shouldn't use your ignorance to destroy yourself. All right, so let us get to the question trivia. You know, Paul, Udeme, so many people on my YouTube and the people on my Facebook. I want to ask you a question. What is APGAR score? Type on the comment section. If you type what APGAR score is and you get it right, I guarantee you I will make sure I do what I know what best to do. What is that? I usually give a giveaway. What is this giveaway? It's just a token for people, you know, when you answer my questions, and I'm sure that you were attentive and you understand everything I'm saying, okay? So that is why I'm going to give the giveaway. So now, my question is, what is APGAR score? Type on the comment section. I want to hear it. So Mr. Paul and every other person, so many of you on my live, both on YouTube, what do you think APGAR score is? What is APGAR score? And the next one is, APGAR is APGAR, right? Type on the comment section and tell me what A signifies, what P signifies, what G signifies, what A, the next A signifies. You know, there are two A's there, right? The first A, second A, and then finally, what is R? My final question now is, what are you going to do as a parent when you have given birth? Because there are some people, children, babies, you deliver them, right? APGAR score was fantastic, and then all of a sudden they start desaturating. Okay, what will you do when a baby has been born and the nurses have given you your baby, or the baby, you know, you're doing rooming in and rooming out, suddenly you start seeing the fingers and toes of your baby turning blue? What are you going to do? Are you going to just be saying, oh no, they said my baby is okay? Or are you going to, what do you think a woman should do when you start seeing that the baby that was already crying and sucking suddenly starts retracting and desaturating? All right, then my final question, whenever you see this video, even if you are not in my life, if you answer any of these questions, you stand a chance of winning my giveaway. Okay, so I'm going to stop here today. Remember, life is too short. Okay, my favorite quote is, health is wealth. Okay, and knowledge is power. Why don't we do whatever we can to make sure we have the beautiful life that we desire? Okay, so I'm going to stop here. Remember to answer my questions. Anytime you get these questions right, I'm going to give you a very handsome giveaway. Please, can you comment on the comment section? Where are you watching from? Where are you watching from? Are you watching from Africa, East Africa, America? Where exactly are you watching for? Can you all tell me? And please kindly share this live. If you are in this live, you have at least understood or listened and picked only one thing in this life, even if it means you understand that a woman is pregnant. It is on you to share this life so that other people will also learn and be able to use this video very logically. Okay, thank you all for listening to my wonderful live streaming. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Okie dokie, we need to stop here. See you soon. We're going to have part 3 of birth asphyxia, because we need to let these trolls know that they don't troll people when they are already down. We've not talked about the complication of birth asphyxia and so many other things that you need to know. And when you know all those things, you will understand that you cannot, for any reason, allow your baby to have any form of birth asphyxia. Okay? Thank you all for listening. This is your favorite doctor once again, Dr. Tonia of True Health with Dr. Tonia. Thank you for watching, and please share me out. Okie dokie. See you soon. Bye-bye. Bye-bye, people in YouTube.